The science behind the vaccine is the same whether or not you do it in adults or pediatrics. So if you're looking at like Pfizer or Moderna, they're still going to be mRNA vaccines. But really, the difference is that you want to make sure that it's, the dosing you're using is safe and it remains effective. You still use the same sort of clinical trial phases that you use for vaccines and other drugs under development. So phase one is to determine like basically safety, like maximum safe dose, any side effects. Usually it's on healthy volunteers, a small number. And then phase two and three are starting to look more at efficacy, where phase two is you'll do some trials to ensure it's efficacious in the lab, and you'll start doing some small samples. And then phase three is much larger sort of number of participants, and you may compare it to existing medications if you're doing a drug, or perhaps existing vaccines or different vaccine groups if you're doing a vaccine. When you look at what Pfizer is doing, because they're the ones that are a little bit ahead of the ball on sort of kids. So at the end of March, they said, we submitted our data. 12 to 15-year-olds have like 100% efficacy and robust antibody responses exceeding those of 16 to 25-year-olds. So you can see this is kind of like a phase three sort of trial where they had a lot of participants and they are comparing the results to existing vaccine efficacy. Vaccines rely on your immune system to build a response, so to have sort of this lasting immunity. It's called the adaptive immune system. And we know that children have a very different response to COVID compared to adults. And this is usually attributed currently to high levels of interferons and other chemicals of what we call the innate immune system, which doesn't really discriminate what it's protecting against, but it's like a catch-all, sort of the first line of defense. And the question would be, does this somehow change how their adaptive immune response would be? Would it still be just as efficacious? Likely, yes, because vaccines seem to work better in, children than say older adults with waning immune systems. But we don't know this for sure. So you want to make sure that it's still effective, and also if there's any different side effects that you might see in children that you might not see in adults, because their body may respond to it differently or perhaps clear it differently.